opportunity to learn about 3 selected cases in updated medical programs in health resorts.
Health prevention and rehabilitation is the top priority for healthcare system in each European country. 3 groups of our products, our programs. First, recovery after acute medical conditions. It is, for example, after oncological treatment, after chemotherapy, radiotherapy, the spa stay, or after some operations, injuries, and so on. Then it was very traditional, the point 2, management of chronic diseases. This was in the spa, it was the top product 20, 30 years ago. And the point 3, it is very important nowadays, the product prevention of common occurring diseases like, as I mentioned, cardiovascular, etc., etc. And I put there now the post-COVID syndrome. ESPA must focusing activities to primary prevention and solve the main problems. Increasing overweight and obesity at any age as risk factor. It is the first. Then, dramatic global increase of post-COVID syndrome, and also increasing immunity disorders. These 3 problems are now on the top, and we can be involved to each one with medical spas in Europe, and to help to solve this problem. I am sure that European spas are ready to engage in primary health prevention. In which way? Implementing lifestyle modifying programs. Many of you have such programs. Then also education is very important. Spa therapy is a complex therapy. Balneotherapy and climatotherapy, it is our European heritage. We use it, especially balneotherapy, using natural healing resources like mineral water, thermal water, healing colloids, healing gases. We are using this. Also, I must mention, for example, therapeutic concept according KNIPE, or in Czech Republic according PRISM. It's very, very similar. That it is our European heritage. We push on the practice in Slovakia obesity program, and what is our goal is that it is partly paid by insurance company. We must have also another program. We are talking about many immunity, preventive program for boosting immunity. From 1st January 2022 will be new international classification of diseases, and all this COVID-19 disease and also post-COVID-19 conditions will have the new code. Please mention it, and it will be for us in Slovakia now need to change our legislations.
Rogaška Slatina is a well-known health resort where our water, Donut MG, has its spring. Donut MG is the richest water with magnesium in the world. It contains more than 1,000 milligrams of magnesium, and if you drink 1 glass of it, you get all the daily amount of magnesium that your body requires. Donut MG was the base for the development of medicine in Rogaška. So, and of course, last but not least, we offer them psychological support to cope easier with their underlying disease. So our patients back then were around 60% cancer patients and 40% other patients, mostly of them with chronic inflammation, bowel disease, and some with diabetes or other endocrine diseases. And then we monitored the change in body weight. We found out that almost half of them gained weight. The best results were at patients with chronic inflammatory bowel disease, which was expected, and the worst results were at patients with gastric cancer. Eating disorders are quite often seen at our patients. We are talking about dysphagia, nausea after eating. We are talking about loss of appetite. As expected, the highest percentage was observed at patients with stomach cancer, but here we can see that all the patients have reduced eating disorders after 2 weeks of rehabilitation in Rogaška. We help them with individual dietary support and also with conservative physiotherapeutic measurements. And we also can see that fecal disorders are reduced by the end of gastroenterological rehabilitation at Medical Center Rogaška. We started also to add them supplementary enteral nutrition with eicosapentazoic acid, and we discovered that it really helps. It helps to improve them lean body mass. More than half of them are cancer patients, and the other 40% chronic inflammation, bowel disease, and other patients. So here we can see a change in body composition. Body composition is measured by bioimpedance, and here is the amount of weight that they gained. Patients with colon cancer gained the most weight. For us, it's also important to functional status of the patient. And for that, we perform some different tests, like the Burke's Balance Scale, which is the test to assess the functional skills of the body. We measure pain by a visual analog scale, and here we also can see that the pain is reduced by the end of rehabilitation. We see that we really help patients to improve the quality of life. We help them to gain weight, to make an improvement in lean body mass, to perform better, and of course we try to help them to eliminate functional disorders.
The rehabilitation of cardiovascular, metabolic diseases, and neurological diseases. We use here mineral water. It has a beneficial effect for all those pathologies that I mentioned. In Medical Center Terme Ptuj, we treat the pain in the spine, post-trauma and post-operative conditions of the locomotor system, sport injuries, and other degenerative conditions. We have here also thermal water, which has proven and established healing properties. In Moravske Toplice, they have the same rehabilitation programs, which are overwhelmed with programs for skin diseases and rheumatic diseases. Here is also black thermal mineral water, which is the most precious asset of Terme 3000. And now I'm going to present you our rehabilitation program for the patients after surgery. And at the end, also the analysis of effects of our programs. How good are we? So we are using physiotherapeutic and occupational therapy procedures with the aim to ensure and restore optimal functions and consequently improve quality of life of patients. We want to rehabilitate the trunk functions, return the patient to normal living environment, restoration of functional working abilities, prevention of disease progression or deterioration of health condition. We want to improve health through training. We include healthy diet, and we put so much effort to learn and to get information to the patient about the disease and how much the prevention is important. So the patient has an individually prepared exercises, and we counsel about activities, when to progress to jogging, running, ball sports, and so on. And now I'm going to present you the analysis of 83 our patients who did our program in our centers. The blue color shows us the pain, the intensity of the pain for each patient before the rehabilitation, and this orange color, the intensity of the pain after the rehabilitation. Here is another point of view. And here we can see that all our analyzed patients had pre-rehabilitation pain on average 4.47. And after the rehabilitation, 53% also had post-rehabilitation pain, average 3.14. We did the same to assess the pain in lower limb. So the blue color shows us here the pain before rehabilitation, and here the orange one after rehabilitation. And here we can see that 65% experienced lower limb pain before rehabilitation with average pain of 5.26. And this percentage lowers to 45% with an average of 1.89. So this is a very good result. 18% had pain before the rehabilitation, and they cannot walk more than 1 kilometer because the pain really increased. But after rehabilitation, this percentage decreased to 8%. 37% mentioned that they have disturbances during sleeping, and the pain reduced their sleeping normal before the rehabilitation, and after the rehabilitation, this percentage reduced to 8%. Nearly 69% of patients told us that they cannot sit more than 1 hour because of the pain, because of the increasing pain. And after the rehabilitation, they were very satisfied with the program, and this percentage reduced to 18%. So we can see here from 33% who cannot stand more than 1 hour before rehabilitation, this percentage lowers to 7.23. In our medical centers, we have a combination of unique natural healing factors, expertise, modern equipment, and dedication. So the science and nature, enriched with human warmth, work together for a long and healthy life. And thank you all for your time and attention.